Well, hello and welcome to Living Healthy 24. Today we have got a very special guest, Dr. Sanjay Kumar, BDS and MDS from University of Calcutta. Presently, he is a professor and head of Department of Orthodontics, KSD Jain Dental College and Hospital. He has got a brand called Smile and Brace. Let's welcome Dr. Sanjay Kumar. Welcome, Doctor, to our show Living Healthy 24.
Thank you, PG, for nice introduction, and thank you, Living Healthy 24, for giving this opportunity.
Great. Doctor, today we have got multiple questions on dental. So we will start with the some of the general question which like every person has got in their mind. That what are the most common dental problems?
Okay. So, most of the patients in our clinic are presenting with coming with some sort of dental cavity or its sequence, its sequelae, like pain, abscess, etc. Other group of dental problems are gum-related issues, gum disease, gum problems, which progress to periodontal disease, periodontal abscess, bone loss, mobility of the teeth, and loss of the teeth. So these are the two main categories. Apart from this, there are aesthetic needs. People come with crooked teeth. People come with discolored teeth. They want to enhance the appearance of the teeth. They come with shape problem of the tooth. They want to reshape it. Cosmetic restorations they want. And of course, there are other rare categories like dental cancers, oral cancers. Those are also a problem. Yes.
Okay. Do you think dental problems are on rise these days?
Uh, well, in a sense, yes, because dental problems are there in the human history uh, 10,000 years back. But nowadays, due to change in dietary habits, like we are now taking mostly processed food, and which is rich in sugar. So, yeah, in a sense, dental cavities are increasing in recent population.
Okay. Do you think or do you believe dental problems are preventable?
Of course, of course, because most of the dental problems are due to microorganism which is there in the mouth, and we can eliminate microorganisms from the mouth by proper oral hygiene aids like brushing, flossing, doing proper mouthwash, etc. So yes, most of the dental problems can be prevented, and if the patient is visiting, doing the procedure, oral hygiene procedure, and visiting the doctors at right frequency.
Okay. Is it true that dental diseases are genetic?
Dental diseases are by and large not genetic, but the tooth shape and the features, anatomy are genetic, inheritable. So we inherit defect in the tooth from the parents, which can lead to accumulation of plaque, and that may result into dental diseases. There are few hereditary dental diseases, but those are rare.
Okay. Is there any home remedy for the dental problems?
Okay, so home remedies like brushing, doing mouthwash, even salt water range, these are the things which we can do in day-to-day life. If somebody is having pain in the teeth, they can apply clove oil. This is there since long time back. So these are the home remedies we can do. Anything beyond this, a patient should get checked up with the doctor.
Okay. Now, why it happens that, like some of the people, why does one develop a cavity in some teeth?
Yeah. So as I told you previously, there are some teeth which has smooth surface, which are less likely to accumulate plaque. But some teeth are surface are rough, they have pits and fissure. So those pit and fissure accumulate plaque, and hence, if you don't brush properly, it leads to cavity formation. Apart from that, between two teeth, there are areas where food gets stagnated, and most likely we miss that area, and then they develop cavity.
Okay. This is a very simple one. Okay. Now, how to avoid dental caries in young kids with baby tooth?
So this is very important question, and all the would-be mother, expecting mother should know this. So if child is born, the day child is born, their gum pad should be cleaned with soft cotton or gauze. The day tooth erupts after feeding, it should be cleaned with the clean gauze or cotton. And if the child as child develops motor skill, like by the age of say 3 years, he should be taught brushing in simplest manner. Toothpaste can be added little later because young child can swallow. There is a risk of swallowing the toothpaste. They generally swallow. So toothpaste can be added little later when spitting reflex, spitting skill child learns. That is after 4 years. Before that, mother can take some paste, little bit paste, and they can do the brushing, assist the child till the age of say 3 years. After 3 years, a child should learn.
Okay. Is Are these chocolates responsible for cavities?
The chocolate is very rich in sugar and they are sticky also. So, too much chocolate all the time definitely leads to poor oral hygiene and hence cavity and other problems. The children cannot, it's very difficult to say no to chocolate to most of the young kids. So there is a way of eating. You can give chocolate, but that is just before any staple food, not after staple food. If the child is taking chocolate before staple food, and then the moment they are chewing chapati and all, chocolates are clean. So there is a self-cleansing effect. So that way, in moderation, chocolate can be given, but chocolate after food, taking chocolate and then don't brushing leads to dental cavity. Yes.
Okay. And what are the treatments for this cavities? Any options and all on the treatment level?
Okay. Yeah. So, dental cavity, we have to understand dental cavity progression. The at the initially when the tooth surface is attacked by acid or cavity, there is surface demineralization, and that demineralization can be reversible if the child is using some sort of fluoride range. But if cavity leads further and it becomes real cavity, which accumulates the plaque, then uh, filling should be considered. Dental filling of maybe silver or white colored filling material can be added. But if cavity progresses even further and reaches the nerves, then possibly this will require nerve canal treatment, root canal treatment will be required.
All right. Can we save a painful carious teeth?
Of course, because nowadays the technology, dental technology and material science has advanced to the level, and the skill of the dentist has improved to such a level that a doctor can remove the infected pulp and infected substance inside the tooth, and then it can be filled with inert filling material, and then the tooth can be restored with a crown or cap. So a painful tooth, you need not to go for extraction. It can be saved and it will function as normal tooth, as any other tooth.
Okay. Apart from caries, are there any other way of tooth loss?
Yeah, so caries is the main way of losing the teeth, tooth material, but there are other way of tooth loss, like tooth grinding. Some people have a habit of grinding the teeth during night or maybe during clinching. So we call bruxism during nighttime and bruxomania during daytime. That leads over the period of time that leads to a substantial loss of tooth material. This is one. Number two, some patient has faulty brushing technique and they use too much force and very hard brush, and that can lead to cut in the neck of the tooth, and that is called cervical aberration, and that cut can be deeper and can reach to the nerve level, so tooth will start paining. That will require root canal treatment. So we advise the patient to the public to brush properly. There should be proper way of brushing. The quality of brush should be optimum. It should not be too hard, not be too soft. So this is number two. And number three, erosion. Some patient, some person can have habit of having alcohol, carboxylic drink like cola and etc., which is acidic, and that leads to leaching of enamel, and that also leads to tooth loss.
All right. Now we'll talk about some gum problems and bleeding gums and all. So my question is that why
Yeah.
does a gum bleed?
Okay. So, in the oral cavity in the mouth, bacteria are there. They are there. On the skin, on the skin, we have germs, and every day we take bath morning and night. So to remove the bacteria. In the mouth also, we should practice good oral hygiene morning and night, at least brushing the teeth morning and night. And if we don't brush properly, then after brushing, after 1 hour of brushing, the bacterial colony builds up, and these bacteria, if left in the mouth to build up, then they are substantial in number, significant in number, and they produce acid and toxins, and that toxins act on the gingiva, gums, and then they cause swelling, inflammation of the gums, and it further the decay product goes inside around the gum, and it leads to bone loss. So tooth gradually becomes mobile, it loses the attachment. That's the cause of gum bleeding.
Okay. And what are the causes of tooth mobility?
Tooth mobility, if the gum disease progresses further, so it dissolves the attachment of the tooth. The bone becomes soft and bone level goes down, down, down. And after a critical level, tooth moves. Tooth starts moving, and that leads to excessive mobility. And if such disease is not checked, then there is further bone loss and tooth may exfoliate. Yeah.
And what are the treatment options for gum problems?
Okay. So first option is prevention. Prevention is better than treatment. So we should practice good oral hygiene practice, morning and night brushing, mouth, dental flossing to clean the in between the tooth surface area, and regular dental checkup. Regular dental checkup, say 6 months, once in a 6 months is optimum. But in our country, even if it's once in a year, that's welcome. That should be there. So doctor can check the disease, can find the disease and apply therapeutic measures.
Okay. So the main thing is that it is really highly recommended to everyone that one should visit the doctor every in 6 months for the regular.
Every 6 months.
Is really
Yeah, if not possible, once in a year. That's must.
okay. That's a must. All right.